We hope that you enjoyed the show. There are so many more for you to listen to right here on selfdiscoverywisdom.com. Come and hear the illumination that's going to shed light on your path.
Find your path with the knowledge of others. Become an illuminator for those who struggle. Guide their way just by being truthful and being in alignment, because it comes naturally to find your path with the knowledge.
Good morning, good afternoon, and good evening, folks. Welcome back to another edition of mental health awareness right here on selfdiscoverywisdom.com. I'm your host, Sarah Troy, and my repeat guest, this is our third show together, is Dr. Susan Blumberg. We've talked about all sorts of subjects, and I really do invite you to go and look at her show page. Simply go to selfdiscoverywisdom.com and put in Dr. Susan Blumberg, and you will see all shows that we've done. The wonderful shows on nonverbal learning disability and autism spectrum disorder in youth and adults, and also navigating marriage, communication, and raising neurodivergent child. And of course, today we're going to be talking about the hidden struggles of adult women with ADHD, masking misdiagnosis and burnout. And believe me, with a person with ADD, this is exactly the kind of topic that we need to be talking about. So she says that adult women with ADHD frequently experience delayed diagnosis due to the internalizing symptoms like inattentiveness, emotional dysregulation, and heavy masking. Special considerations for women include hormonal impacts on medication efficiency, high rates of comorbid anxiety and mood disorders, and a significant risk of burnout from compensating for those executive dysfunctions, either at work, at home, or both. Women often don't get diagnosed until their children are diagnosed, and then they recognize their symptoms. They begin to experience difficulties at work or treatment of their misdiagnosis and depression or anxiety and stops working. Cognitive behavior therapy, life coaching focused on executive functioning and communication skills. Susan has support groups, and targeted medication management are all effective interventions. As I said, we have to go back. Please listen to the other show. She goes in depth to all of these subjects and how we live with it. She's most certainly fully qualified, been doing this a long time. Her passion is children, especially teenagers. Hate even say them. But really neurodivergency, it's the springboard, isn't it? It goes right across the board. You're never just one thing. There's always a smidgen of this and that. And it's all about navigation. How do we navigate it? And I am a woman with ADHD that only discovered that 2 or 3 years ago in my late 60s. I was given diagnosis of dyslexia way back when I was 21. So that's 50 years ago. So it's still that well, what is it and what do you do with it? How do you manage it? We don't want to be slapped with a label. We are not ADHD. It's something that we have, and that means that's where we're coming from, and we're going to perceive things differently. And I think that's the biggest frustration to get across to people. Hi, Susan.
Hello, Sarah. Thank you for that lovely introduction. You covered all the points I want to make today. So now we need to dive in and understand them.
Yes.
One of the key points for adult women with ADHD is you've actually had it all your life.
Mm-hmm.
You were probably born with it. There's a high genetic component. There are, it's a nature and nurture situation. It is a neurodevelopmental disorder. I want to be very clear about it. Right? There is a big genetic component, but it also comes about because of changes in your brain wiring. Mm-hmm. Okay? So it's not something you caught. It's not something you were, that was caused just because of the foods you ate. Yes. It's something that's different in the way your brain works. And so I want people who get the diagnosis later in life to feel a sense of relief.
Yeah.
You've been struggling with this all
Yes.
your life. What you finally have is a label to help you understand what you've been dealing with forever. Okay.
And that you're
And
not a loser.
right.
Because so
You've
many people feel
always
they
had
are.
these
Yes.
struggles,
Yes.
but now we have the opportunity to get you the supports and the
Mm,
treatment and the coping skills that you need to be able to cope with life.
mhm,
Now, the first thing I want to say is that medication is generally the first line
mhm.
of support, but pills don't teach skills.
No, no, they don't.
So, the research on ADHD, both for children and adults, is that multimodal treatment is the absolute best practice. That means whether you're a child, your child, or you as an adult, medication is not the only approach. What it will do is make your brain receptive to learning the coping strategies and treatment that you need to change all the negative or disruptive or let's say
Lack of
uh,
focus.
well, the pills will help with the focus and attention,
Yeah,
but now you have to unlearn all the dysfunctional
yeah.
ways of coping that you've had all your life, whether you find this out in your single digits, your teens, your 20s, 30s, 40s, 50s, or 60s.
Hmm.
And I've known people who were diagnosed in all those decades.
Hmm.
You've learned more functional or dysfunctional ways of coping, depending how late you found your diagnosis. And now you're open, whether from someone like me as a life skills coach for teens, families, and adults with later diagnoses. I work with all those groups. You can come to me or people like me for help. And then I can teach you more effective coping strategies.
Right,
The
right.
pills simply help you with what's wrong in your brain, that dysfunctional wiring that I already mentioned. You now have a label for it. The meds make you able to have the focus and attention and calmness that you need to learn good coping strategies.
Does it slow down the chatter in the head?
For many people, it does.
Right. Because I think, let's actually understand what ADD is. I mean, a lot, or ADHD, attention deficit hyperactivity. Is
Right.
that right?
Right.
So um, I just go by ADD. I don't know if I've got the hyper or not.
So, what happened was in 2013, when the last edition of the diagnostic manual came out, they renamed the disorder. So, there used to be ADD and ADHD prior to
Mhm.
2013. But after 2013, it's called ADHD inattentive type. That's what used to be called ADD, hyperactive type, or combined, where you have both.
Right.
So, you
Okay.
have ADHD inattentive type.
Okay. There I have it. Right. But I don't think people actually understand, you know, um, sleep is very hard for people with ADD because how do we switch off, right?
Yes,
I've always had a movie going on, and I can get
yes.
anal in that movie, the color, the smell, what are they wearing, da, 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 the lighting's not right, you name it, and get
Yes.
stuck on the detail and not able to sleep. But if I actually do want to calm down and kind of somewhat meditate, I've got to give my brain a task to do. It isn't a question of, just silence and stillness, which I promote all the time, but it's give your brain something to do so you can find that silence and
Yes.
stillness because you can't do it without giving it a job. Otherwise, it will
Yes.
be
So,
da 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 da.
so for my daughter, when she's having trouble falling asleep, we make a plan. What would you like to dream about tonight?
Hmm.
What story would you like to tell yourself as you fall asleep? And we come up with a plan of what she can think about or plan for, or what story she wants to tell. And then that's what she does as she's falling asleep.
I get too interested in my story. I mean, like
Well,
you say, it's four
obviously,
o'clock
you
in the
have to be
morning.
careful, right? You have to be careful.
Yeah.
She loves to listen to classical music,
Hmm.
instrumental music, nature sounds, lots of calming noises, stories, music. That can be very, very helpful.
Well, you know, the old adage, you know, counting sheep, it's boring. You got to focus on each sheep, and then, you know, next thing you know, everything switches off. But yes,
Right.
if you, if,
Counting backwards by threes.
ah,
So I start at the number 1,379 because I found counting backwards by 100. I got to zero and I wasn't asleep yet. So
hmm
I pick a larger number. My current number is 1,379. I get to 500 or so and I'm asleep. But you must do it by threes because counting backwards by ones is boring.
hmm
Counting backwards by threes works for me.
hmm
Some people count backwards by sevens, gives you a little bit of concentration, but works for falling asleep. So, all of these are coping strategies. Let me come back to where I started here, which was the point of medication is to deal with some of the neurological and neurotransmitters that are off in the ADHD brain. And I want to talk about in women some of the hormonal issues. So,
hmm
there is some very solid research that looks at our monthly cycle and
hmm
how it impacts our use of ADHD meds. Some women, it has been found, if you have very strong cycles or PMS, it can impact the efficacy of your medication. You might need higher dosages certain times of the month. And at menopause, the higher or lower estrogen levels can have a significant impact on your
hmm
ADHD med, and you might have to change your dosages.
hmm
And so, finding a psychiatrist who monitors your medication, who is familiar with the research about how women's hormonal levels impacts their ADHD medication can be critical.
hmm
And so these are questions you have to ask when you're working with a psychiatrist. So I just wanted to finish that thought before
right.
we moved on.
Yeah.
It's
And not
very, very
everybody needs to
important.
go on medication, right? I mean, some people prefer not to, so then it's,
Preferring not to is
mm,
absolutely fine, and I'll address that in a moment. But again, the biggest research studies say combination treatments, that is, behavioral or psychological treatments plus medication, is the most effective. But there are psychological and behavioral treatments that are very effective without medication.
right. I think we have to just look at where we're at in our lives, right? Do
That's
I
right.
need that extra
That's right.
help, or is this something I can navigate on my own?
Right. That's right. And for example, I have a 22-year-old right now who's working a night shift and in college, having difficulty concentrating on his homework. He would like to use meds on an occasional basis.
hmm
For example, he's doing fine in his classes and in his night shift, but is having trouble getting his homework accomplished.
hmm
So he would like to use meds 2 or 3 days a week when he has time set aside to do his homework. He doesn't need them to concentrate in class. He doesn't need him at his
Right.
job, which is repetitive work, and he finds that easy to concentrate on, but he clearly needs it to get his homework accomplished.
Now let's address that because, you know, I mean, I've even got a show coming up on antidepressants and how they make people so dependent on them that they can't come off them. So many people commit suicide because they think they're fine and they come off it, and it's a major crash. So you're saying with these pills, you can literally take them as needed, and then you're not going to become kind of dependent on them. And then if you want to leave them, have to pay the price.
Well, let's talk about the antidepressants. I want to say one comment about your antidepressants. Antidepressants must be tapered. You
Yes.
cannot go cold turkey.
hmm
There's a large movement now helping people come off their antidepressants.
Yeah.
There is no need to crash coming off
Right. Yeah. He's
antidepressants
come up with an
anymore.
entire system,
Yes, there is a
breaking down.
system. You must taper them. You must monitor it with your psychiatrist.
Right.
Going cold turkey
hmm
is the problem.
Right.
But anyone can come off their antidepressants smoothly. There is a system for that. You can use other medications to help you come off your antidepressants properly. There is no reason to crash off them anymore.
Right.
We
Yeah.
know how to manage that. Again, use your psychiatrist to help you do that.
hmm
Now, Stimulant medications, and there are several types of ADHD meds. They are not all stimulants anymore, though there are different kinds. However, stimulants have a very short half-life in the body. That's why you have to take them sometimes twice or 3 times a day,
Ah.
because some medications only last 4 hours in your body. Some last 12 to 18 hours. So they're gone out of your body very,
Right.
very quickly.
Good. So there isn't that dependency on it
No,
or the
you
right.
cannot become dependent on these medications. They move out of your body quickly. That's why there are extended release and long lasting versions. So it gets you through a whole day. Both my children take a long lasting dose in the morning and they take an afternoon booster so they can get through homework when they were in school or get through their evening chores or activities
Mm-hmm.
because they need a short acting afternoon booster or they crash at 3 or 5 in the afternoon and they can't do any evening activities. Now, the point being that if you want to have everyday relief from the chatter, from the lack of focus, from the inattentiveness, you must take them every day.
Mm-hmm.
They don't last. So if you take it
Right.
on Monday, you have no meds in your body by Monday night.
Right.
And Tuesday will be a disaster.
Right. So I
Right?
think it's kind of is gauging, if you know you've got a lot on your plate and you're going to have to really be attentive with that, you take them. If it's a chill day and your head can go off and chatter and it doesn't matter, that's okay. You don't
That's
need
right.
them. You're not needing to focus, but this ultra focuses you in on whatever is demanding of you in front of you.
Exactly. So the thing is, you can't do that on your own. You
Hmm.
must monitor it with your doctor. And I highly recommend using a psychiatrist. I have to say strongly that general practitioners know nothing about this. They
Hmm.
use whatever their farm rep tells them to write
Right.
prescriptions for, but especially, again, we're talking about adult women with ADHD here who might have hormonal imbalances, who might not have been diagnosed until later in life, and general practitioners know nothing about this.
Hmm.
I have to strongly recommend from 40 years experience and a lot of research that you must use a psychiatrist who understands adult women with ADHD.
Hmm.
The same way that I recommend pediatric psychiatrists for children. Your pediatrician or general practitioner is not sufficiently educated to make good decisions about whether or not you need it every day or only sometimes.
Hmm.
Okay, I just have to give that warning.
Right.
A lot of people want to use their general practitioner or their pediatrician, and I just have to say you're not getting the best advice possible.
I will add an added here in Canada, we have a shortage of doctors, so trying to even
It's true.
get to a psychiatrist.
It's true.
But
In the US
yeah,
as well.
yeah. So it's like you may not be able to get to one straight away, but then obviously talking
But
to someone like you. Yeah.
telehealth is still available.
Hmm.
Once you've made that initial contact, many psychiatrists will continue to work with you on telehealth, especially since COVID. And
Yes.
that has really, really helped the situation.
Right. Right. Because basic what you're doing is just having somebody monitor that you're using it properly and that recognizing a side effect that you may be not recognizing,
Exactly.
pull back a bit on that, maybe increase it during this time. And it's just, that person is, the like the matron in the hospital, just
Right.
monitoring and making sure the
Yes.
treatment is following
And
rules.
and I often help with that. I am no longer a licensed psychologist, which I was for 30 years, but because I have 40 years experience, if I see a client is having a side effect, I can make a recommendation that you go see your psychiatrist as soon as possible.
Right.
One more thing about the meds, and then I want to move on to talk about other treatments. Because these meds have such a short half-life, you can change your dosage quickly.
Hmm.
Unlike antidepressants, which can take 4 to 6 weeks to come to full effect, if you're not seeing the impact you want at this dose within a few days, no more than a week, change your dosage.
Mhm.
It's not like you have to wait weeks to see if a
Yeah.
dosage is working.
Yeah.
They work immediately. So if your doctor starts you on a low dose and you're not seeing any effect, call your doctor, get your dosage changed. You see immediate impacts with these medications.
I'm going to look at this from a different angle. As you know, so many women with ADD very often are entrepreneurs. And a
Yes,
lot of it is because kind of working in the corporate system or other systems kind of didn't honor them and their system and the way they do things, because entrepreneurs very often do things differently, right? And we don't go down the straight and narrow and tick all the boxes. We do the cha-cha-cha and and the Rambo and everything else that's going on to get our results. So it's like very often that's where the overwhelm comes in, or that where it's
yes,
like I just can't deal with it because there is no straight line for us. And
right.
so having medication that like I know I've got X, Y, and Z on this week, and this is what I need to achieve, then this is the good time for the pills to keep you focused, that so you're not swaying left and right so much, but perhaps
Yes,
actually moving forward,
yes.
because we can't do things quote normally. And what is norm anyway? Um,
And I'm going to say typically,
typically,
because there is
right,
no such thing. We're all normal. We all
right.
have our own
I
normal,
know that, yeah,
but we don't do things the way neurotypical people do.
right. Right. And so, it's okay if you're doing things differently. That is who you are, that's how you're wired. But what we're wanting to do is just hone you in a bit, that you can be focused, that you can accomplish what it is you want to do without feeling it kind of like that static, that when you see
Yes,
people kind of being, you hear the voice and the face is going like this on the screen. Sometimes we feel like that. All right. You
yes.
feel everything is coming out of you statically. And it's like, people saying to you, take a breath, just meditate.
No, it doesn't work like that.
I'm screaming here. I can't do that. So the medication will
So
certainly help with that.
absolutely. So there's a very adorable meme I've been seeing lately on TikTok where somebody's like doing the dishes
Mm.
and they tie themselves to the dishwasher with a towel and their belt loop because they get distracted and they want to leave the kitchen when they're
Right.
cleaning the
Mm.
kitchen.
Yeah.
And every time they try to walk away, they're tied to the dishwasher so they can't walk away, right? They get being pulled back. And I
Yes.
think it's an adorable meme, right?
And so realistic.
And so
Yeah.
realistic, right?
Yes.
Because they hear a noise or they think of something else to do and they keep trying to walk away from the kitchen.
Squirrel.
Right, exact butterfly,
Yeah.
whatever it is. And so I think it's an adorable meme and very applicable
Mhm.
here.
Yeah.
So to me, in addition to medication, or if you choose not to use medication, as I said, there are excellent behavioral and psychological treatments. And so, as a life coach, and if you choose to use cognitive behavioral therapy, which is what my work is based on, that was my training as a
Mhm.
psychologist. The first thing that ADHD clients need is to learn executive functioning skills. And
Yeah.
there are 8 core executive functioning skills, and you can break those into smaller categories, but there are overall 8 core executive functioning skills. And that squirrel and butterfly example is
Mhm.
what we call impulse control.
Mhm.
Impulse control is being able to stick to a task and not run off everything in sight.
We're very good at multitasking, but we're not
No,
an
you're not.
octopus. We've only got two arms.
No, you are not good at multitasking. And in fact, the research says nobody is good at multitasking,
Mhm.
even though people pretend to be. When you multitask, you have less efficiency in every task.
Right.
And impulse control is being able to stick to one thing and complete it. The next is emotional control, which is not getting sidetracked by your feelings
Mm.
when you need to be on track with something. And then, I mean, there are many, I'll mention a few more. One is flexible thinking. So,
Mhm.
flexible thinking is when plan A doesn't work, we have a plan B or C or F or M or XYZ, because
Hmm.
you never know what the world is going to throw at you.
Right.
And therefore, you have to plan in advance and be able to be flexible enough to switch to another plan when your plan A doesn't work. People with ADHD are terrible at this.
Yes, yes. No, no, I'm going to make this work. I'm just going to keep going until it works.
Right.
Right.
And then we get the sunken cost fallacy, which is because you've poured so much energy into plan A, you can't see that it's not worth continuing and you need to move to another plan.
Hmm.
So, flexible thinking is a very important executive function skill. Another one is working memory, and people don't realize this is an executive function skill. Working memory is how much information you can keep in your head
Hmm.
while you're doing something. And research shows that in general, we can remember 7 digits, plus or minus two. Now, 7 digits used to be a phone number. When you and I were little,
Yes, yes.
7 digits was a phone number. I can still remember my childhood phone numbers. We had a family phone number and I had my own phone number, and I still remember them. But now phone numbers are 10 digits.
Hmm.
A lot of people can't remember more than one. And
Mm.
so, and because we have them in our phone and we can say,
Right,
Siri, call,
right. Yes.
and right, then we don't even remember phone numbers
No,
anymore.
no.
And think about when you're at school or at work, right? And you have information for your maybe more than one kid, your husband, yourself. How do you keep that all in your head?
Right.
You can't. So you have to have strategies to keep directions and plans going because we cannot keep it all in our head anymore.
Yes.
Other ones include task initiation. How many times do we sit down with a whole list of things to do and we just can't get started?
Nope. Nope.
So we have to have strategies for that.
Hmm.
And then we have what we call planning and prioritization. And that's not what you think it is. Planning and prioritization has to do with visual memory.
Hmm.
Can we look at a task and plan how we're going to get it done? Then we have time management and
Right.
time blindness. Do we know how long a task is going to take? And can we manage our time properly? And then the one everyone thinks is what executive functioning is, and it's really number 8 out of 8, is organization of our materials.
Aha.
Everybody thinks that's number 1,
Right.
but it isn't. It's number 8. It's like I have piles of things on my desk and floor that periodically, once every couple of months, I put papers in files and I put things in folders on my bookcase, and then I know where they are again.
Yes. Yes. Kind of working in the chaos.
That's right. And so there actually 8 executive function skills that people need to learn. And so whether or not you take medication, having training by a therapist or a life
Mm.
coach like myself in these 8 executive functioning skills can help people at home, at work, organizing their family or their jobs. And it works for children, it works for adults. Because people with ADHD, autism, learning disabilities, they don't absorb these skills just
Right.
by watching other people do them the way neurotypical people do.
And I don't know whether this is an ADD thing or dyslexia or just me, is that if I ever am learning anything, I need to see the visual, I need to write down the process,
Yes,
and then I need to do it. Once I've done it 2 or 3
that's
times, it's in the head. But don't just
that's
show me
ADHD.
something because I need
Yes,
to write 1, 2 step, 2, 3, 4 step, um, just to remind myself because, yeah, it's brain fog. I always place that down to the fibromyalgia. And, to add
that
another thing,
also contributes.
right. Yeah, I'll talk about that in a moment. But it's the other thing to add, you don't remember the phone numbers. The biggest thing I think nowadays is forgetting passwords, right?
Yes,
That's a nightmare.
yes.
Which
And how
password
many
did
of
I
your
use for this?
passwords?
Yes, yeah.
We have to put 8, 10, 12 digits in our passwords.
Yes.
That's way, and you have to have different passwords for everything. You can't use the
Exactly.
same
And
one.
which one is for which? And did I put it down on the form? Where is it on the form for me
So
to find it?
we have to have a password manager in our
Right.
phones or
Yeah.
somewhere else
Hmm.
because you cannot use the same one. You have to remember them. Which letter is capitalized?
Right.
What is our
Yes.
special character? Plus,
Yeah.
exclamation, question
Yes.
mark, slash. That's a working memory problem.
And that is a nightmare, because I mean, God knows how many passwords I have with running this, on so many
Yes,
things, and it's trying to remember which one is which. And
yes,
is it normal? Because I never know if because yes, I have fibromyalgia. I don't know if it's fibro or the ADD. Uh, Retention. Just some things I really want to retain it. And this I really remember at school. I wanted to learn, but I could
yes,
not learn the way they were teaching me, and I just couldn't
yes,
absorb it at all.
yes,
And I still do have that in certain situations where
yes,
it doesn't matter what you're talking, I'm seeing the word mouth move, I'm just not retaining what you're saying to me.
yes. And it probably started with your ADHD, and the
Mm,
brain fog from the fibromyalgia makes it
right.
worse.
Yeah. Double fog.
Yes. Yeah, so ADHD people don't generally experience the brain fog as it's
Hmm.
described in fibromyalgia. What they do experience is the difficulty, here's the working memory again, moving things from short term memory, which is stuff
Mm.
you remember for a few minutes, to long term memory,
Yes.
where you
Yes.
remember it for days, months, or years. That is an ADHD problem.
And I find if it's repetitive, it stays. If it's not repetitive, it's gone.
Oh,
Like my daughter said, but I said this to you last week. I didn't absorb it. It didn't go into kind of data bank. And
right,
so, you've
right.
just got to repeat it.
Yes,
And she
yes,
doesn't like to do that. So I think, bottom line here, folks, on that particular subject is be patient with somebody with ADHD because, they're not trying to piss you off, right? It is a genuine battle that we're facing here.
right.
So, hand them a note that's written. Okay, this is what you want, right? And I can probably keep that note or I can address that note. Don't just trust the verbalization you're throwing at me
Correct.
and expect me to retain it. Because sometimes it's just like, a bad moisturizer. It doesn't moisturize at all. It doesn't get absorbed.
I love that analogy. That's fabulous.
A while ago, I did a show. I asked ChatGPT, is there a correlation between dyslexia, ADD, and fibromyalgia? Because a lot of it is that hypersensitivity, hyperactivity. And I wanted to see if there were any crossovers. And there was masses of amount of crossovers. And so sometimes you don't know, is it one thing or the other? Or are they dancing together? And I think it's just like maybe not separating them, but just looking at them as they pop up and trying to address it as to what it's identifying as rather than trying to identify which one it
Mhm.
is.
Yes. Well, that's so interesting um, because, yeah, I'm looking between dyslexia and ADHD, comorbidity is 25 to 40%. And mostly it's a genetic situation. It's
Hmm,
not that one causes the other. They
right.
don't, there's no relationship
Hmm.
between them. You can have one or the other or both.
Hmm.
The reason there's a higher comorbidity is that they're both genetically linked.
Uh-huh.
So that if you have a parent who has one or both, it is more likely that you will have one or both.
Right.
So I
Hmm.
just want to be clear about why there's a comorbidity risk.
Right. That's interesting.
Because both my kids have ADHD, so does their father. None of them have dyslexia or reading disabilities
Hmm.
of any kind.
Right. I don't know where I got that one from because my mother
Mhm.
was an avid reader, my brother's a writer. My father was a businessman, so I don't know if he
Right.
was a reader or not. But yeah, I think, we can go round and round and round in circles trying to identify who, what, where, and when. I think it's
Right.
just
So I
like,
just wanted to
yeah,
comment on
no,
that
no,
about
that's
why
what I'm
there's
saying. Yes, yeah, and this is the reason why I did that particular show. Is like, I have a whole personality trait which shows the crossover of personalities, and I wanted to know with this, is there a crossover? And kind of that crossover just made that sometimes it's a double whammy.
yes,
Right. And that,
yes,
and that's obviously where that medication can come in when you're in that double whammy, with the
right,
fibro flaring up and the ADD flaring up. It's like that is the overwhelm. You're not going to get, I
yes,
get those days that shut me down and I can't do anything because just
yes.
incapable of doing so. So that's where the
Well,
medication would really help.
yes. And another comorbidity issue is anxiety and mood disorders.
Yes.
So, a lot of women who don't get diagnosed with ADHD until they are adult, and again, because they don't get diagnosed often until their children get diagnosed,
Hmm.
so they tend to be at least in their 30s or 40s because you have to wait till their kids show it, and maybe
Yeah.
their kids are 10 before they're diagnosed. So therefore, they're 30 or older. Is that except that the parents may already have been diagnosed, the mothers, with either depression or anxiety.
Hmm.
When they that's not their primary diagnosis. They're
Right.
given those diagnoses because they're showing those symptoms because
Hmm.
of undiagnosed ADHD. So they have poor executive function skills. They're caring for their children. They may have a high powered or corporate job. They're caring for their household,
Hmm.
and what they're experiencing symptoms of depression and anxiety is because they have undiagnosed ADHD that's driving them to have these
Yes.
emotional symptoms.
Right.
And
That makes
once
so
the
much sense.
ADHD is properly diagnosed and treated,
Hmm.
which can mean medication and coaching and executive function skills, the experience of the depression and anxiety is greatly reduced.
That
Because
makes
the
so much sense.
reason they're depressed and anxious is they don't realize that they have this neurodevelopmental disorder.
That's very interesting because, I took my whole family to get assessed and they came across with my kids with ADD, and my husband with ADD. And all the doctor told me was I had OD, overdoing it, right? And he
And
did,
that is the dismissiveness of
right.
undereducated, often male doctors
Hmm.
who don't understand ADHD in women.
Right.
And I want to say something about this because, one, ADHD in women often is inattentiveness, not hyperactivity.
Hmm.
Male doctors, physicians are not educated in executive function disorder
Hmm.
at all. A huge overprescription of anti anxiety
Yeah.
medication. Nice, nice lady, you just calm down and everything will
Right.
be fine,
Exactly.
right?
Or
It's
off to a shrink you go. Yeah.
that's why you don't discuss it with your primary care doctor. You see a psychiatrist
Right.
who, and you have to ask for one
Mm.
who understands or is willing to read the research about adult women with ADHD.
Mhm.
That has to be one of your prerequisites. Say, are you familiar with this research? Are you willing to read this research? I'm seeing this life coach who handles this. Are you willing to talk to my life coach? Right? And you understand the hormonal impacts on ADHD meds. You have to find a psychiatrist who's willing to answer yes to those questions,
Right.
right?
Yes.
And because
Yes.
even female psychiatrists are not always up on all this
Oh,
research,
oh, I know. I
male
know.
psychiatrists have no idea. But the other piece of this is if they're not aware of the impacts of low executive functioning. So, say you come and say, I'm overwhelmed at work, I'm feeling burnout. The first prescription is for an anti anxiety med,
Yes.
not an ADHD med.
Right.
And that's because women with ADHD have been misdiagnosed for decades.
Hmm. Yes, it always was kind of diagnosed as a kid thing. And I think that's kind of like early 90s. Every kid suddenly had ADHD and every kid was put on Ritalin. I wouldn't allow my kids to be put on Ritalin. We just kind of navigated it. But it's like it just became almost like a fad.
Yeah.
But nobody was really looking at what is it really and what can we do about it other than slapping a drug that kind
But
of
I put
numbed
my
them
kid
out.
on Ritalin and it was life changing.
Hmm.
So we put her on an anti anxiety med. No, we put her on Ritalin because she came to the she was already on an anti anxiety med. And she came to the psychiatrist one day, and since she had spent the whole day looking at her chair from the bottom,
Mm.
she was literally lying across her chair with her feet off one side and her head over the other, looking at her chair from the bottom.
Hmm.
So we started her on Ritalin, and a month later, she literally got a perfect score on her state mandated math testing. Literally. It was like, oh, look, there's a worksheet. It has math. I can do this. Ritalin was life changing for my
Yeah,
daughter.
I had other parents with kids the same age as mine, and the complaint was is that they were numbing out, that they
Oh, no.
just that
Yeah.
they had
But that may mean one, they were on the wrong medication,
hmm
stayed on the wrong medication too long
hmm
because either they got it from their pediatrician, not an educated pediatric psychiatrist
hmm
who could. There are a dozen different kinds of stimulants. There are non stimulant medications. There are 20 different medications you could try. So if they were numbed out on one, they should have been switched to another one within a week.
right, right.
Right?
Yeah,
But they
that
were
that
not seeing
definitely
the
was
right
not
doctor.
happening.
They were
Mm,
not changing the medication
no,
fast enough. You see? So all that means was a bad doctor, not a bad medication.
right, right. And of course, it, until I think people began to see what ADD or ADHD was, is that the kid was a bad kid, or the parent was being a bad parent, right? Because get your kid under control, or get yourself
And
under control.
were they getting behavioral therapy as well as medication management?
Hmm.
Remember, the first thing I said when we
Yeah,
started talking 45 minutes ago was multimodal treatment is best
right.
practice.
Yeah,
They must have medication plus behavioral and psychological treatment. Pills don't teach skills. So,
right,
one, they
right.
were on the wrong pill if it zombied them out, wrong pill, wrong dosage, something. Two, were they learning executive functioning
Hmm.
skills? Were they
Hmm.
learning psychological management, emotional regulation? Were the parents getting parent coaching?
Yeah,
No, I'm
no,
betting not.
no. Or certainly back in the 90s, no, it was just slap on a pill
I've been
and that
doing
was it.
this since the 90s.
Yeah. No,
I did this then. This research study was happening starting in the early 80s, ran through 2000. We knew this in the 90s.
yeah, it wasn't being practiced, that can tell you.
Not, well, people like me were practicing it.
Uh-huh.
It
Few
means
and
they
far
were
between.
seeing the wrong doctor.
Exactly. And, doctors, and also, I do find that a lot of doctors don't want to be told anything by their patrons, right? So,
Right? So
it's
it
having a
means
doctor
they were
that is
seeing,
open.
right.
Hmm.
But parents have a say. Parents don't have to listen. Parents can educate themselves. This stuff was known in schools. I mean, I have been doing this work since the late 80s.
Hmm.
So people like me have existed since then. I have
Right,
lots of
yes.
colleagues.
Few and far between, though.
No,
You
it's
needed
not.
more. Well,
It's
maybe
in
here in
some
Canada.
areas. You're in
Yes.
Canada, I'm in the
Hmm.
US, but I have worked all across the US in multiple states since the late 80s. I did it by conference call, then I did it by Skype. I've been using Zoom for 10 years, way before COVID. I have been doing this all over the country. Now, there are some areas, in rural areas, it's harder to find.
Hmm.
Not every state offers all the same services, but this information has been available for 30 plus
Yeah,
years.
certainly, not given to us at that time. It
That's hard.
basically was a label and drug, and nothing to do with, behavioral help or anything like that at all.
And the
So,
research, unfortunately, was available, just not everybody made it themselves educated. It's sad. But let's
Right.
come back to where we are, which is now the adults
Yes.
who didn't get it back then when they were kids, but
Nope.
now they're
You were just
finding
a
it.
troubled child.
Right. So now they're in their 30s, 40s,
Yes.
that their kids are being diagnosed, or they're burning out at work and
Hmm.
they're looking for help.
Hmm.
So, where do they go to find help? They start with their general practitioner, but more often they start on the internet.
Yes. Yes.
And the good news is you can find people like me. You can find psychiatrists.
Hmm.
You can go to your insurance company and say, I want to talk to a psychiatrist. And you can find lists of doctors. You can go to Psychology Today. They run a wonderful directory of psychiatrists. Excuse me. There's a group called Adults with ADHD.
Hmm.
ADDA is the acronym. They run adult support groups
Mm.
for adults and some just for women that offer support groups where you can meet other women like yourself and other adults like yourself. They run several annual conferences, one just for adult women with ADHD every year, where you can learn about what's available and meet other people like yourself.
Yes. They
You
feel not alone.
You
Hmm.
can go online and search for life coaches for
Yes.
women with ADHD. You'll find me. You'll find lots of other ADHD coaches. There are lots of services available now.
Now, do those services also do the diagnosis if somebody suspects they may have that?
Okay, not so much. You have to do the actual diagnosis to get the medication. You have to find a licensed psychologist or psychiatrist
Right.
if you want medication.
Hmm.
But you can start with a life coach, a support group, and
Hmm.
get a referral to a psychiatrist.
Uh-huh. Yeah. Because, I mean, obviously, um, when something is discovered, all of a sudden everybody has it, and and it's all diagnosed online and this and that, etc. It's kind of, I think, getting a reliable thing. Is it ADHD? Is it something else? And I think it's like, again, that identification. Okay, now I know what I have. Now the research and what and whom can help me navigate
Yes.
it. But I think a lot of the time is like, do I or don't I? How do I find out? What you're talking about
We
sounds
can
like
help
me.
with that.
Right.
Right. Self diagnosis is legitimate.
Yeah.
This is a big conversation in the disability community right now, particularly in adult women with autism.
Hmm.
Unless you want medication,
Right,
you don't need a formal diagnosis as an
right.
adult.
An identity rather of it. This tick, what you're talking about is ticking all my boxes, and now I can actually understand that's probably what my problem is. So,
So if you start with someone like me or in the support groups,
hmm.
self diagnosis is acceptable.
Hmm.
If you decide like we said, not everybody wants medication.
Right,
But if you do decide you want medication, we can help you find a psychiatrist or psychologist who will do the appropriate assessment.
right, right. And of course, we are talking about that you are in the States, so there's different
So in
organizations in different
Canada,
countries.
yes, I can help you connect with them
Ah,
because I run international Facebook groups.
aha, right.
You
Yes,
can join. There are many Facebook groups, and you can ask, I'm in
yeah.
this country. Can somebody direct me to a psychiatrist?
One that knows what he's doing, or she,
Exactly, or
right?
she is doing.
Yes.
So
And I think
we
that's the
can
most
help you with
important
that.
thing is that any diagnosis is a kind of a pain in the butt, label. But if we take away the label and go, oh, identification of why I'm struggling in this area or that area. And I think it just gives that permission in a lot of ways just to be
Exactly.
yourself, right? I am what I am. But now, how do I, what do I need to apply in order for me not to have it overtake me, but me be able
Yes,
to be the conductor?
exactly. So again, that's where the skills training comes
Hmm.
in. So I work with my adult clients on communication skills, the executive function skills. I'm working with a woman in her early 60s right now on social skills because
Right.
she feels that she hasn't been able to create friendships. She even feels
Hmm.
awkward at church sometimes
Hmm.
because she doesn't know how to connect with other people.
Right.
So we're doing some social skills training.
Here's a question for you. Frustration, I think, is quite common with people with ADHD, but is there a difference between the frustration and anger? Are you seeing kind of anger different with ADHD? Because frustration, I think, is kind of quite normal for us because sometimes we just can't come across the way we want to. But what about anger?
Well, I think that's very individual.
Hmm.
I would say people who have really severe anger management issues,
Mm,
I'm probably not their first line of treatment.
right, right. Yeah,
They belong in anger management classes. They almost definitely need medications because anger is, you've crossed a certain line of
yeah,
intensity,
yeah.
right? They're not looking for executive function skills.
No. You still need to find, though, an anger management that does understand ADD, though.
And those are hard to find. A lot of
Right.
anger management classes are court ordered because you've
Mm,
crossed the line.
hmm.
So when you talk about anger, we have to talk about the context.
Hmm.
Have they broken the law? Have they become violent?
Hmm.
Are they just is it emotional
Right.
dysregulation we're talking about?
Yeah.
I can absolutely help with emotional dysregulation.
Right.
Are we talking about someone who's crossed the line into violence or criminal activity? I can't help with that.
Right.
That requires a different level of intervention.
And I think as if we find in ourselves, anybody with ADHD, I think frustration does come into it, as well as the
Yes,
anxiety, just because, frustration that you can't get things done the way you want to, or people aren't getting what you're saying or doing, or people are judging you because you're hyperactive, etc. And I think that frustration comes and then will turn into anger out of that frustration. As you said, there's different levels of anger and what steps they go into that. But I think that anger is purely frustration of I don't seem to be able to get my message across or be able to accomplish the goals I
yes,
want to accomplish. So
yes,
it's
yes.
more based in frustration rather than.
And that I can absolutely help
Hmm.
with. But then I will also have to worry about, are they self harming?
Hmm.
Are they cutting? Are they drinking? I have a client right now who's using marijuana, but she has now been clean for almost a month
Hmm.
because we have been working on emotional regulation. She was able to identify, she's 27. She's able to identify that she was using marijuana because she couldn't manage her big feelings.
Right. Right.
And so we have helped with coping skills to manage big feelings. And she's been clean and sober for nearly a month now.
Yes, I imagine a lot of people with the extreme ADHD that drugs are a way of kind of shutting things down or calming things out. And just like when everything feels like it's screaming, you want to stop the voices, you want to stop the sound. So people go to whatever's going to numb that.
Yes. So she went to the psychiatrist. She's gotten some other medications now. We talked about how she was using the marijuana instead of appropriate medications
Hmm.
for her conditions. She has not just ADHD, but she has some medical conditions. She got appropriate medication started. We taught some coping strategies, and now she's been sober a month. So it has really been helpful. So again, the anger issue, it's all about what the
Hmm.
source is,
Hmm.
what lines they have crossed, and whether they're willing to accept, intervention.
Yes, yes. And I think if anybody, like, a lot of people, no, I don't have ADHD, but all the boxes are there being ticked. And it's like, just, this isn't a stigma. This
No,
isn't something putting you down. This isn't
so glad
something
you
that
brought it up.
making you're not less than. It's just, this is the way that you've been wired and you function in a total different way to regular people and how they do it. So the whole thing is learning to manage what it is. And actually
Exactly.
look at it, it can be a great gift because the creativity that comes out
for
of a
many
lot of
people.
it. Yeah. So it's like tapping into that creativity. But then what's the point of tapping into the creativity if you don't have the skills to do something with it? Right. So it's helping you actually manage that vision so you can bring that creativity to the forefront.
Well, and think about a lot of these women, as we said before, who have been giving meds, SSRIs
Mm,
or anti-anxiety meds, because they were mistakenly
yeah.
diagnosed with a mood disorder
Hmm.
instead of properly diagnosed with ADHD. And when they're switched to an ADHD med and slowly tapered off
Mm,
their antidepressant or anti-anxiety med, then that really opens up a lot for them because now they're medicated for the appropriate condition
right.
and their brain opens up to learning new coping strategies
Yes.
as opposed to being medicated for the wrong condition. They no longer have to mask. They
Mm,
no longer have to deal with emotional dysregulation.
hmm.
Instead, now they're available to learn the executive function skills, to learn the communication skills that their brain wasn't open to
Uh-huh.
before.
Right. Wasn't articulating the way, what's in the brain and what comes out.
That's
You've got people, well, they just like say anything, it just comes out. Don't they have any control? And like,
right,
it doesn't matter which kind of
right,
ADHD, that is the case for some people
right.
because everything is going so fast. There's a kind of, I recently watched the documentary on Robin Williams, who
Yes,
was just an incredible soul,
yeah.
absolutely brilliant comedian, and a person who really felt with his heart and soul. But in those last pictures, the sadness in his eyes. And it's like, as people said, he couldn't keep up with what was going on in his head all the time. And if ever anybody needed something to help calm it down and bring it down and regulate it, was him. But of course, there
Well,
was no conversation of it then.
Van Gogh is one of the examples I frequently,
Hmm.
speak to because I mean, his paintings are some of the most gorgeous
Hmm.
in the world. And in fact, my phone picture is his Starry, Starry Night.
Right.
And this is the actual painting. I got to see it live at a museum in New York when it was brought over on an exhibit, and I took a photo of it. So that's his actual
Mm,
painting. And yet he was very troubled.
yes.
He had many mental health conditions, including bipolar disorder, that was untreated at the
Hmm.
time because nobody knew about those things. And of course, he had a very tragic ending to his life, and he was not appreciated when he was alive.
Right.
Nobody appreciated his brilliance until much later on. And so it's a
Nikola
very,
Tesla. There's another
right,
one, right? Yes, there's
right.
so many.
Tesla, there are
Yes.
many people like
Yes.
that, but he is one of the ones I think of regularly because I look at him on my
Yeah.
phone every day as someone who just think what he might have been able to accomplish with appropriate treatment. And
Yes.
yet, people always wonder if he had been appropriately medicated, his mental health would have been better, but would we have seen his creative brilliance?
And I think that's the thing, Robin Williams and him, even Nikola Tesla, their brilliance is almost outshining them. And they
Right.
just can't cope with this illumination of what is coming to them. I
Right.
think that the evolution of our mind and body is still forever growing. And I think, for them it was the human body and psyche couldn't cope
Yes.
with the gift that they were given and how to
Yes.
use it. And yes, would we have that brilliance that they gave us, had they been able to manage that executive function? But that is, the people that are that extreme brilliance um, are not the everyday people. That's why they are the
They're
exception.
outliers.
They're
They're
right.
outliers.
And so we can be still brilliant in our own world. We can still follow that creativity that we see and that we want to accomplish.
Mhm.
It is all back down to that kind of managing it in a functional way that allows us to express what we see, how we feel, what we
Yes.
want to contribute in a way that it's coming across clearly And also in a way that we don't feel like we're kind of rapid firing, you know?
Yes. So I want to give some examples of this. So my daughter is 31. She has been on an antidepressant since she was 8 years old. She's been on stimulant medication since she was 9.
Mm,
So 2/3 of her life.
right.
My daughter has 5 diagnostic labels. She has autism, nonverbal learning disability, panic disorder, Tourette's syndrome, and fundamental neurological disorder, which is a full body system dysregulation disorder. She also has a bachelor's degree
Mm-hmm.
in biology with a minor in chemistry, and she's an accredited pastry chef from the Escoffier School, which is one of the major culinary schools in the world, based in France. They only have 2 schools in the United States, one in Texas, one here in Colorado. She is an extraordinarily creative pastry chef.
Mm-hmm. Mm-hmm.
Amazing things. And she specializes in gluten-free and allergen-free baking.
Right.
And you
My daughter will
cannot
love it.
tell that her food is gluten-free.
Right.
So, for example, my son is getting married this October. She
Mm-hmm.
is making the wedding cake.
Yay.
And the bottom layer will be chocolate with fudge frosting and a raspberry filling. The top layer will be vanilla with a caramel frosting and caramelized banana filling. She's doing fondant designs, and she's making 200 macarons in 3 colors. She's an extraordinarily creative and
You
competent
imagine
person.
she'd also be in her element. Like,
Yes,
just, she's got the skills, obviously, that you've given her through the years. Just leave me alone, let me do it. I know what I'm doing.
right.
Right. And I've interviewed an awful lot of people with autism, whether it's the parent of the autistic child or the autistic child or adult. All right. And one of the things that I find, and there are always different layers, like flaky patriot, lots of layers there. But for the most part, I find that they are very creative, right?
Yes.
And that it can be extremely focused, but very selective of who's around them,
Well,
right?
let me
Lots of
finish if I
boundaries.
may.
Yeah.
So she worked in a bakery for 2 years until her neurological disorder got more disabling, and she's not able to work in a 9 to 5 sort of job now,
Mm,
but she bakes out of our home. And the reason I'm telling this story is she's been on medications for 17 years, give or take, maybe more. And she has conditions that are disabling in many ways. And yet her creativity
yeah.
and the excellence of her baking are
Right.
top level, right? People, and she dresses beautifully. She cares for her hair. She does beautiful makeup. She looks gorgeous. You cannot see from the outside, this is the
Aha.
point of the story,
Yeah.
that she has any disabilities
Right.
until you interact with her for a longer period of time,
Hmm.
because she does not shake hands or hug. She has limited tolerance for crowds or being
Hmm.
around people. She wears headphones in public a great deal of the time. But you put her in front of an oven with a
Hmm.
recipe,
Hmm.
and magnificence comes
It's
out.
her orchestra. Right.
Right,
Exactly. Yeah.
right. It is her area of excellence.
Well, that's what I was saying. Right. That's
Right. So
the
I
gift
so
that,
exactly. She has a tremendous gift.
yeah.
And so what I want to say for many adult women with disabilities, in this case with ADHD, what I really want to encourage them to see is that they can be
Anything.
wives,
Yes.
mothers, they can have professional jobs,
Hmm.
they can be entrepreneurs
Hmm.
like you and I are. And yet they can have disabilities, they can get appropriate treatments, they can get support. You mentioned before, it does not have to be a stigma. They
Right.
can be bakers, they can be
Yes.
chefs, they can be brilliant corporate officers. But what they need to understand is that they can be on medication, they can receive executive function coaching, they can get cognitive behavioral therapy, they can belong to support groups, and they don't have to be ashamed of who they are.
There's nothing to be ashamed of.
But they were
Um,
taught to be
they were
ashamed
taught to be
growing up.
absolutely. You are less than because you're not
It's
like
not that
everybody
there's
else.
nothing to be ashamed of. They
Right.
were taught to be
Yes.
ashamed Our society, the doctors that they talk to who put them on
Yeah.
anti-anxiety meds and don't send them for appropriate evaluations, their bosses who say you have to work extra hours, you don't get to have time, quiet time or wear
Right.
headphones, right? They're taught to be ashamed. And what I'm saying is that there are supports for you. There
Yes.
are coping strategies you can learn. I can do that. There are many like me who can do that for you. The medications are going to make a huge change in your life. You can be successful in whatever area of your life you want to be. You just have to reach out and grab it.
As in, I go back to that wonderful word, flawsome. Right?
Yes.
It's,
Isn't it great?
ADHD is just a little flaw. Whatever diagnosis you have, it's just a little flaw, just like a beautiful broken porcelain bowl that's been put back together with gold. It's
Yes.
putting yourself back together with self-love. All right. And
Yes.
just understanding, okay, this is ADHD, this is that. I'm putting it all together. That is what makes me up. But I am fused together with self-love of who I am, why I am, and the gift that I've been given. Because I believe everybody is born with a gift, and our journey is to learn how to use it,
Right.
and in a way to, and how can we be of
Right.
service with it? And it's like, don't beat yourself up, right? It's just
Yes.
look to the gift in it, and
Yes.
the things that you can't manage, learn to manage, learn to understand how to use that executive skill, make it
Yes.
easier on yourself so that your light can shine bright without you feeling it's close to burnout.
Yes. Yes. That don't accept burnout, don't accept being pushed past your limits.
Right.
Know that there are supports for you. Know that there are coping skills you can learn because you deserve those accommodations. You deserve those
Yes.
supports. You deserve that treatment because what's going on in your brain is okay. It's just a different way of functioning. And we can help you. People like me can
Mm.
help you be the best possible person you can be.
Put systems and strategies in place that just
Exactly.
makes that all that chatter, all that scatteredness, all that lack of focus in place so that you can go, God, I have this brilliant idea. I want to follow it through. Now I know what I need to do in order to bring it to manifestation, because I'm
Yes.
not going to get either burnt out or distracted or fearful that I won't be able to achieve it. But there's a big thing that you said about that selectiveness. And I think another thing that ADHD people need to understand is that a big word, no. No, I don't want to do this. No, I don't want to take that on. And no, 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 because I think for all of us, that needing of space and silence and time just to be with ourselves is imperative. And I think for a lot of people, they feel what they need to be doing this and doing this, or they don't know how to say no when people constantly saying, do this, do that, do this, come and join us, da da da. And you look like you're antisocial. That no, you're recharging, you're recalibrating.
Yes. Well, I always say no is a complete sentence.
Yes.
So important. But here's the other piece of it. As women, we've been taught to be sort of the underpinning and foundation of our
Mhm.
family. So, since I have three members in my family, all of whom have disability labels except me, I am the executive functioning brain of our family.
Right.
And so then I have a future daughter in law with ADHD and my son who does as well. So I'm helping plan their wedding. It's
Hmm.
my job to keep track of all the bits and pieces and
Yes.
make sure everything's happening on time. So I meet with them every couple of weeks. I have a list. Let's check off everything on the list. I have willingly done that, but then they still have to follow through on the things
Yes,
they have to follow
exactly.
through on.
Exactly.
That's a very important piece of this. I'm willing to be the structure,
Hmm.
but they still have to follow through on things. As women who have determined that they have ADHD as adults, one of the important things we learn as women is we say, I'm sorry a lot.
Hmm. Yes.
We say, I'm sorry I can't do that. I'm
Right.
sorry I didn't get this done on time. I'm sorry I can't fulfill this job, activity, I'm sorry I got my kid late to practice,
Hmm.
whatever that is. And one of the things, once we learn what we're dealing with, we also have to stop the I'm sorries
Yeah.
because that's not serving us,
No.
right? It's saying we're weaker, we're not good enough. But what's really important is that we step up for ourselves
Hmm.
and say, I can use these new executive function skills I'm learning to plan and prioritize my schedule, to organize myself better, to use flexible thinking. If plan A doesn't work, I have plan B and F and Q and XYZ because I'm allowed to have backup plans
Right.
because life doesn't work on plan A all the time.
No, no,
Right?
no, 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 certainly
Right?
not. Yeah.
Life is what happens when we're making plans,
Yes.
especially if we are neurodivergent, right? When we have a disability label. But what's also important is that we allow ourselves to be human,
Hmm.
that we make mistakes. Even neurotypical people make
Yes.
mistakes. I yelled at my children. Here I am, a parent coach, an
Mm-hmm.
executive function coach. I was a child clinical psychologist for many years. I still broke down and yelled at my
Hmm.
children. But then afterwards, when I was calm, I would go back, I would apologize, and I would attempt to repair the damage. That's what a healthy person does.
Yeah.
So we don't have to say, I'm sorry because I can't live up to somebody else's expectations.
Yeah.
But we can say, I'm sorry when we make a mistake
Yes.
and repair the damage.
Yeah.
We can also, as we've already said, set appropriate limits. You don't have to work all the overtime.
Right.
You can
Right.
build in self care time during your day. If I work an hour, I need a 10-minute break to
Hmm.
recharge. Maybe step outside and get fresh air or step away from our screen. I'm planning a 3-hour workshop in 2 weeks where I'm going to be up in front of an audience on Zoom giving a very powerful workshop on empowering teen success. I realized the last time I did it that I didn't give myself enough breaks.
Right.
And when it
Right.
was over, I literally collapsed on the floor. I
Yes.
couldn't stand up anymore.
Yeah.
I'm giving myself some longer breaks this time. My co host is going to remind me to eat a granola bar halfway through. I have to take care of myself to serve my audience.
Precisely.
Adult women, we have to care for ourselves. That's part of being a healthy adult.
Right.
We're allowed to do that. And once we discover we have a diagnosis like ADHD or dyslexia, we have to build in time to care for ourselves, even though we may say, but, I have a job, I have a husband, I have 2 kids. It's the airplane story.
It is. Yes,
We
every
put
time.
the air on ourselves before we take care of our children or someone we're traveling with, because if we don't put the air on ourselves, we'll pass out before we can take care of anybody else.
Exactly. And even as you said, like that 3 hour thing, it's taking the breaks not just for yourself, but for them to digest what they're hearing, instead of all of it at once, and then it kind of bouncing off them because they're unable to absorb everything at once. And I think we are being taught to push through and rally on. No, no, the pause is good for everybody. Right. Let's just take 5 minutes and everybody take a deep breath, kind of reset, recenter, and then, can get back into it. And I think if we can pace ourselves in our lives that way, we will find ourselves able to manage things so much more. It's like, know what your diagnosis is. Um, I've got a couple of them. And I know, especially with when my dyslexia, when I really do start reversing a lot, I know it's a warning to me, right? You're either overtired or over this, over that. It's
Yes,
generally over,
yes.
right? So
You're
it's,
learning to recognize the
yes.
signs.
And it's like, what do I need to do right now? It's like, A, don't take on anything more, right? If I still have to do this, then that's all I'm going to do and focus on. And then go and remove myself from the situation. Can I come back and continue? Great. And if I can't continue, that's okay.
Yes, yes.
The
There's a
signs.
wonderful There's a wonderful Far Side cartoon by Gary Larson. Are you familiar with those
Yeah.
cartoons? And this boy, big boy with a very teeny head, raises his hand and says, Mr. So and so, may I be excused? My brain is full.
Yeah. Yeah.
I love that cartoon.
Yes.
We have to learn to listen to ourselves. Again, we
Yes.
mentioned earlier, uh, ADHD meds, once you're on them, are susceptible to less efficacy during hormonal surges.
Hmm.
So if you tend to have PMS the week before your period, your medication may be less effective. And so you need to pay attention to your cycle. Once you
What
go
about
through,
menopause?
well, I was my next sentence. There's a lot of research that says after menopause, you may need to be upping your dosages because your hormonal balance may be off and you may need to change your dosages. There's
Hmm.
some very excellent research that's been released in the last just 2 or 3 years when people started studying this. Not in
Yeah.
the US, by the way, in
Right.
Scandinavian countries where they're a little more advanced than we are on studying
Right.
these issues.
Yes, I'm seeing that actually being talked about a lot on social media, on ADD and hormonal, and
Yes,
that whether you've gone through menopause or not, you've the equilibrium is off, and so that can cause many problems. And the
yes,
thing I think you just like, fibromyalgia has numerous points to it, right?
yes,
And it's, ADHD does as well. And you may have
yes,
one section of it that's more dominant than another. And it's
yes.
like the more you spend time with yourself and navigate, I pay attention, write down notes. Oh, I notice I do this when that's happening. And it's like, kind of assessing yourself and how you manage things,
Right,
right?
right. Yes, which is why medication alone is not
Yeah,
sufficient. Now, you can have behavioral therapy alone, but medication alone is generally considered insufficient, whether you're a
right.
child or an adult. You must have behavioral and psychological therapy as well, which is where a life coach like myself or a cognitive behavioral therapist is so important because you must learn executive functioning skills and other coping strategies. It just makes all the difference.
Yes. I mean, why struggle?
Exactly.
Why get yourself into that, it's almost flight or fight, you're either fighting with something or running for something with squirrel and butterfly and
Right.
everything else. It's like,
We've
focusing in.
Yes, we've actually changed that phrase in the last 10 years or so. We now say flight, fight, or freeze.
Ah, yes, I haven't
So,
heard
what
that.
is freeze?
Right.
Freeze is when you get stuck.
Yes.
Stuck
Yes.
is when you're staring at that screen or the work you have to do
Mm.
or the pile of laundry
Yeah.
and you feel unable to take a step in any direction.
Right. Right. Yes, I know that one.
Right. And so we
Yeah.
have now made that is now the new way of thinking about. We're all familiar with fight or flight, but really in the last 10 years or so, the research says freeze is equally a response that we see regularly in people.
And the thing is, when you do freeze, everything about you wants to move and you can't. You're actually
Right.
kind of paralyzed
That's
there for
right.
a moment. And
That's
it's
right.
like, it's if you get to that stage, it's just be in that moment, try and manage your breath and it's don't become frightened about being in the freeze, right? Because that just makes it worse.
Well, there's actually a number of books and seminars. There's a wonderful book called The Polyvagal Theory that I highly recommend. It's actually the form of treatment that my daughter has for her fundamental neurological disorder. We now understand it to be a reflex of your sympathetic and
Mm,
parasympathetic nervous system. It's actually a neurological response to psychological and neurological overwhelm. It's
hmm.
not just a moment. Your nervous system actually shuts down, It can affect your breathing. It
Yeah.
can look like you're in a catatonic state. It can last for quite a long time. And there are actually interventions that you can do to help. It includes your box breathing. It's part of an anxiety reaction, and there are quite a few treatments that can be really helpful in regaining control of your nervous system and your thinking processes.
Mm.
So it's well researched now as part of this polyvagal system, and helps you understand why your brain is literally shutting down your body
Yeah.
when you are overwhelmed.
I don't care who you are, what what you're diagnosed with, well, neurotypical, we all go through overwhelm at some point, and we just have
Yes,
got to learn, to pace ourselves. What can we and what can we not do? When do we need the pills for the stimulant? When do we need to actually be calm and listen to ourselves? And all of that navigation needs to happen because then we're not fighting with ourselves in our life. We're not fighting with what
right.
we want to achieve. Like,
Yes, yes,
um, I get so frustrated sometimes because I really want to do this, X, Y, and Z, and yet it's just not coming together. It's like, the screen and
yes,
I too far apart. And it kind of gets frustrating because it's like, no, I really want to do this, and everything about you can't, right? And I
yes,
think it's to let that go. What skills and tools you need to put into place that can remove you from that stagnation, because it's a form of freeze in a way. Um, so you can get back to what it is that you want to do. But an athlete will have various coaches and massage therapists and motivational and this, that, etc. So why can't we have the help that we need to navigate
right.
through this, right? You
Exactly.
are not
Agree.
defected,
No,
not at all. All it
no.
is that you have kind of a condition, the way that you process everything, and rather than it being overwhelming for us, let's find the skills and tools that we need so that we can ride with it and be, nice riding partners instead of fighting like siblings on the same
Yes,
bike. So it
yes,
just brings everything down to I can get on following that vision now. I can
yes,
actually do it because I know how and I know what to put into place to do it. And I think that we're all entitled to that. It's
absolutely.
So just give yourself what you need. Right now, Sue's got a very special gift for us, and that is a free 30-minute call with her where you can actually have a talk with her, where you can talk about, are you or are you not? What can you do? What are the next steps? And see if you are ready to work with Susan. For a lot of people listening to this show today, well, I don't know if I have the ADD, but I think I do from what you've said,
Right,
right? But what do I do now? And that was the first thing, isn't it? What do I do now?
right.
Now I've come face to face with this. Well, what am I meant to do with it? And of course, a call with Susan will give you that understanding of what the next steps are. And that's why it's
Yes,
so important. And also, please go back and listen to our other shows. Although we are talking about neurodivergency, they are totally different subjects addressing different areas. But please go back and listen to them. But Susan, please give your contact, love, and how everybody can get hold of you.
yes. So drsusanblumberg.com is my website. To be able to book that free call, it's callcoachsusan.com. Takes you directly to my calendar. And you can find me on both Facebook and Instagram at Dr. Susan Coaching.
And LinkedIn also as well.
Oh, of course, under my name, Susan L. Blumberg. I think what's really important is you can find me on any platform. I'm even on TikTok, of all places, where I post reels once a week. I think what's really important is that you feel empowered to
Mm,
do something for yourself.
yes.
You're not broken. There's
Nope.
nothing wrong with you. What's important is that you want to get the support and accommodations and skills that are going to help you blossom in your life. And I would love to help you do that.
You are meant to blossom in your life. You were given this gift. You were given these abilities. It's just a question of knowing how to use them. When somebody joins an orchestra, they don't join that orchestra with not knowing how to manage their own instrument. They learn how to use their instrument. so that when they do join in orchestra, they can be in harmony with everyone and then be transcended. This is just an instrument that you need to learn how to play, that
Love
you
it.
need how to be the best of. So, honor yourself and what you need to play that instrument. And don't apologize. We're Canadian, we do all the time. But don't apologize. Just look to how can you empower yourself? How can you manage it so that you can be that best instrument that you are meant to be? And
Love
Susan
it.
Blumberg, by the way, is Blumberg, just in case anybody needs to know how to spell it. Do take her up on her 30-minute call. Find out what are the next steps. Go back and listen to her shows and understand that if we really kind of diagnosed everybody on this planet, we'll find everybody has a little something, right? I think, neurotypical might be less than the other. And it's not anything that is punishing you. It isn't anything that makes you defective. You are flawsome. You've just got to learn how to play that instrument and look at the advantages of it. Because in many, many ways, there is a great advantage with ADHD. Just how we see things, how we hear things, how we feel things. It's just understanding what to do with it, which is something that's really important.
Yes. Couldn't agree more.
Thank you so much for being here again, Susan. Always a delight to have you. We always learn so much. And
Such
of
a
course,
pleasure.
you've got a new book coming out in August.
Yes. A parenting book
Mhm.
for parenting neurodivergent and twice exceptional teens. And it's being launched August 8th. I will send you the information.
And of course, if you put in her name, Dr. Susan Blumberg, here on selfdiscoverywisdom.com, all of her shows are there, all of her books are there, and then you'll be able to do one-stop listening and shopping. So
Thank you.
So, folks, whatever you are beautifully flawsome, and we are all meant to get through this. We're all meant to ride this beautiful wave of life, discover who we are, what we're here to do, and whom to do it for. Don't be afraid to explore what your options are and what you need to be the best that you are meant to be. So, until next time, folks, bye for now. We hope that you enjoyed the show. There are so many more for you to listen to right here on selfdiscoverywisdom.com. Come and hear the illumination that's going to shed light on your path.
Find your path, not live to others. Become